Hi, my name is Linda Blizzard. I am an assistant professor in the School of Nursing at New Mexico State University. I've been here since the fall of 2018. My personal background leading to my research was the over 20 years of direct care nursing, some of it, a little bit of it in some mid-management roles, but even then I still took care of patients a lot. So I have been a direct care nurse in various units. I did specialize in critical care for years, but I've done other things as well. I was a unit manager in some areas, and I was a hospital supervisor at times. So my personal background was I went back to school after working over 20 years as a direct care nurse and a mid-level manager in hospitals, and I got a master's degree and I started teaching. And when I took students back into the inpatient area, which I hadn't worked in for about 10 years, I've been doing strictly outpatient care, which is clinics and ED, emergency department, and operating room, things like that. When I went back into the medical surgical floors and the critical care units, I started noticing there was a lot of necessary nursing care that wasn't being done. And that was new to me. We basically always got the care done 10 years before that. And we're talking the early 2000s. About the same time I noticed this, some pretty well-known nurse researchers started noticing it. And in one instance, it was because she was the patient and she noticed she wasn't getting the care that she needed. So some research started up. So this is a fairly new field. So my current research focus is unfinished nursing care, the nursing work environment, in particular, looking at developing or help develop a career ladder for the direct care registered nurses. Because right now, the only career ladders are mainly in administration. So you could become an administrative nurse or advanced practice type, medicalized registered nursing type roles. Other than that, the direct care nurses don't have a good career ladder. And I do think we need to value that more. And then the nurse-patient ratio is another issue. The fewer patients the nurse has, they're finding the patients have better outcomes. So I'd like to expand on that. And I'm planning a study right now to look at reports of direct care nurses on how much implicit rationing of nursing care they perceive and what the nurse-patient ratio is on the unit they're working on. I'm looking at medical surgical nurses and step-down unit nurses. So I just published my dissertation as an article in the Journal of Nursing Administration, and in that study, I looked at the effect of the perceived leadership style of the unit manager by the direct care nurses and the amount of perceptions of implicit rationing of nursing care of the direct care nurses related to whether or not they perceived their leadership as emotionally intelligent, which mainly means, was the leadership empathetic to the nurses? Did the leadership communicate well with the nurses?